Welcome to the Latin MedTech Leaders Podcast, a conversation with leaders who have succeeded or plan to succeed in Latin America. Please subscribe on your favorite podcasting platform, Apple Podcasts, Spotify, Google Podcasts, Amazon Music, etc. Today, our guest is Mary O'Malley. Mary has close to 30 years of medical device experience. She is president and founder of O'Malley Advisors, vice president of commercial operations at Centerpiece, and a member of the board of directors at MassMEDIC, where she served as a chair over the last 2 years. Prior to this, Mary had senior director level supply management and supply chain positions at Medtronic. She specializes in global supply management and strategic sourcing strategies, commercial and operations planning, M&A due diligence and integrations, supplier diversity, and sustainable supply chain strategies and execution. Mary was recognized in the 2018 and 2019 top 100 lists of women executive leaders in the MedTech industry. And she was recently recognized as a top 15 women in power impacting diversity for her work supporting supplier diversity and inclusion. So Mary, it's a pleasure to have you here today. Welcome to the show.
Thank you very much.
Also, Mary, the thing that I like the most about you is that you are the first woman that I have on my show. And this is great. It's fantastic.
That's nice. Hopefully not the last.
Exactly. That's the idea. So, Mary, let's get started with talking about your journey to Latin America. How is it that you got involved in the region on a personal, professional level?
Yeah, I guess on a professional level, I've had global responsibility for a number of years at Medtronic and, definitely looking at a global supply base, but have found a number of suppliers that are in the Tijuana, Costa Rica regions. And it's just a growing area for medical device manufacturing specifically, which is what I had responsibility for. On a personal level, I've traveled quite a bit in Latin America. I've been to Costa Rica and a number of different countries. My daughter's been there. She speaks Spanish fluently to a number of different areas. So it's an area that I enjoy visiting both on a personal and a professional level.
Very good. And you also live in the Boston area, and I'm sure there's a huge Hispanic community there, right?
That's true. Yes.
Beautiful. All right. So, Mary, what do you see as trends happening in Latin America that are relevant to our discussion today?
I guess what I see is it continues to be a really rich environment for the medical device industry specifically. There's high quality operations there that continues to grow in different, regions. Tijuana is a good example where there's just good representation across a large OEMs who have a nice presence in Tijuana, but also a tremendous supply base there as well. And that's true. There's other clusters. Costa Rica is another med device cluster, I would say. But I'd also comment that there's more advancement of, clinical trials, development work within that region, and the advancement of patient care in the whole Latin America area.
Yes, that's very true. And I also see countries maturing in Latin America, trying to attract more foreign direct investment. And certainly Mexico is doing a great job because of the free trade agreement. Colombia is looking at bringing what's called now nearshoring, right? Because of the geographical position of the country and issues that we had with China, the Trump administration with China and everything. A lot of companies were reevaluating their China strategy, manufacturing strategy, and they were looking at Latin America as a nearshoring place, which is perfect. It's just that the region was plagued with political instability, economic instability, uncertainty, legal uncertainty. But countries are maturing a lot, Mary. I think so. I think the discussion we're having today is timely because you see countries like Costa Rica now joining the OECD, which just happened less than a month ago, which is a big event for Latin America. Nobody is really talking about this, but it's a sign of how mature Costa Rica is now. Is a global player in the global economy, of course. And you have Mexico, part of the OECD. The first country was Chile, Colombia. Brazil is looking to become part of the OECD. So I see a maturing region. So let's talk about the operation that you know in Tijuana. What's really happening in Tijuana? Why is it that all these companies from the US are doing manufacturing there? And why Tijuana out of all places?
I think Tijuana is just a good location because of its proximity to the U.S. and it's easy to get in and out of Tijuana. I've probably personally been there. I can't even count the number of times, 50 times, maybe more. But it's a pretty easy thing for U.S. customers to go, there. And it's also a very nice place to stay if you want to stay there and do business. But, there's just a very strong cluster, specifically in the med device space, that has the talented workforce, the educated team members that are needed in medical device manufacturing, and a lot of high technology there. That the focus on quality and execution is really high and strong in that area. They have a good base of business, and I think the surrounding government and communities have been very supportive of that. They have a skilled, trained workforce that understands the requirements of working in the medical device industry.
And who has built these plants? U.S. companies, Mexican companies? What's the investment behind this? Who is investing all this money in Tijuana?
I think it's global companies. It's, a lot of the large OEMs in the med device field, and there's some regional Mexican companies that are there as well, but I think it's very global. It's not just limited to U.S. There's European companies that are, have a presence there, and they're taking advantage of the strong labor force that's there, and some better economics that they can be found in that region, and then just ease of doing business with them in the close proximity to the United States and the borders.
Yeah, makes sense. And the management is, I guess, what I'm trying to get at is there is kind of a progression or an evolution of these places in Latin America. They first start doing maquila type of work. Then they become a little more sophisticated. They do medical devices, for example, which is a very complex manufacturing operation. I will assume. I've never been to a plant, but I imagine that's the clean rooms and all that involves a lot of high tech. So the management is mostly European, American, and Mexicans are, at least for now, it's just the regular workers. Or am I wrong with this assumption? As of today.
I wouldn't say that. I think a lot of the plants down there have Mexican citizens that are the plant managers or part of that executive team. I think there's some really strong leadership that's available in that region.
Very good. Okay. That's what I wanted to hear, but I didn't know that was exactly the case. Excellent. So yeah, I know of a company in Costa Rica. We can talk about Costa Rica in a second, but I know of, we had a client, it's a company out of Costa Rica called Establishment Labs. And they were part of that cluster of, the story goes back to the maquila work or the manufacturing plants for European medical device companies, US medical device companies, as you were saying. And now the management the management saw the opportunity to build their own company, not act as subcontractors. And now they're developing and innovating in breast implants. And they are one of the top breast implant companies in the world. They trade in the stock exchange somewhere in New York, and they have clinical trials going on in the United States, in Japan. So it's a great example of that evolution that I was referring to, where companies they learn from the experience of working for European or US operators, and then they start on their own, and they leverage on those experiences and that global exposure that they get, and the knowledge that they acquire. I guess the transfer of knowledge is just immense.
Yeah, and I think that's great because it just helps them in terms of their ability and the whole economics of the whole region. If you continue to elevate workforce and give them those opportunities. And I do think there's tremendous learning. Medical device is a great industry to be in. There's continued market expansion, and it's definitely a strong industry to be in.
Yes, agree. And the medical device innovation that you see in Latin America, Mary, is predominantly low-risk devices, syringes and tubes, things of that nature. So I'm always happy to see something that is more complex than that, something of higher risk. For example, I've been in this industry for 10 years. I've never seen a PMA type device in Latin America, except for one case in Brazil that I just learned about a month ago. So hopefully the region will mature, and that transfer of knowledge will be very impactful, and will make local innovation foster, right?
Yeah.
And
But
grow.
I would comment that I don't think it's just commodities that are being manufactured in Latin America. I think there's some pretty complex devices that are being manufactured there, 510K and PMA devices, and pharmaceutical devices. So there's much more complexity, I think, than maybe people really know of. I don't think there's a lot of limitations in what's being considered.
Very well said. Yes, thank you for the clarification. What I really meant is local innovation from locals in Colombia, Brazil, right? If you see the manufacturing environment in Colombia, for example, all you see is local companies just innovating on syringes, which is, there's really no innovation. So that's what they made locally. That's what I really meant. But Brazil, for example, has a very, very strong local medical device ecosystem, not to the level of PMA or 510K devices, of course not, but they export to many countries in the Middle East, for example. I learned about it recently. And that's good. I mean, eventually they will graduate and start developing more complex devices, PMA type of technologies. So anyway, let's talk about the work that you do, Mary. I'm very intrigued by your involvement with Centerpiece, with your involvement with MassMEDIC. So can we talk about that? And your consulting company, how you help companies succeeding, or how you could help companies succeed in Latin America?
Yeah, I recently left Medtronic after close to 30 years there. So I had a great career with a great company, but decided to do something different. So I started my own consulting company, and pretty quickly took a role with Centerpiece, who has their operations in outside of San Diego in the United States, but they're doing quite a bit of work in Tijuana. They have a brand new facility doing contract manufacturing with a lot of great capabilities, and they've opened up an ETO sterilization site as well, so they can be full service in that region. So, I'm pretty excited to be part of that team, and seeing that, business really be able to service, a number of different customers, both large OEMs and some regional ones. So that's been really exciting for me. I've continued to stay involved in MassMEDIC, which is the trade association in Massachusetts. I've served as the chair for the last 2 years. And the last year for the pandemic has been really interesting because we've been mostly, an advocacy organization and networking organization, but we really shifted to a digital virtual platform, and been very involved in the Women in MedTech series and supporting and promoting women in MedTech. And just think it's a great organization with just so many resources, and proud to continue to service and work with them.
Very good, very good. Now that you touch on that topic of women in MedTech, I've seen a recent interest in diversity in MedTech. And there's even a newly created Latinos in clinical research. There's a newly created Latinos in bio, something like that. I think out of Massachusetts, out of Boston. And it's great to see that, because I don't often find Latinos or women involved in MedTech.
Yeah, I mean, I think it's great. I mean, I think these types of, organizations or networking groups are really coming up to really help support, some of the, historically underrepresented either women or, diverse people that are that want to expand their careers into medical device. So I think it's been a really great support system. We had a MassMEDIC Women in Network event last night, just networking and just really getting to know people and learn from each other and figure out where we can help each other.
Excellent. Very good. Very good. Yeah, I'm trying to keep on top of the activity of Latinos in Bio and also that other Latinos in clinical research organization. And the idea is to network and kind of support each other in our personal goals. But the other advantage that I see here specifically for Latinos is that somehow the region, by having Latinos in MedTech, the region gets a more active role. In other words, the region is present on people's minds, because I think, Mary, that Latin America has been a little undervalued by the MedTech community. For clinical research, certainly is a place that has been receiving trials, but not to the volume that I love to see. I think there's so much potential for that, and we're just starting to see that. And I don't know what your take is, and I'd like to hear your thoughts on the UMDR and how that could potentially benefit Latin America. What do you think?
Yeah, I mean, I think that companies are always going to be looking at what's the most favorable place to do clinical trials and do that R&D work. I mean, the EU MDR just, added some additional restrictions or rigor to the whole process, which I think is good. I mean, it has to be a tightly controlled and regulated industry, and I think that is true in Latin America as well. But I think, companies are going to look for regions that it's, easier or conducive to doing those, clinical trials or doing R&D. And I think, Latin America is probably well positioned to just continue to raise their visibility. They've demonstrated their capabilities in terms of being able to be that manufacturing center and having those clusters. And, I think as healthcare advances in those regions too, it's just going to open up more opportunities.
Yes. Yeah, as you said, as healthcare advances, I think that the healthcare systems of all these countries in Latin America are maturing a lot, rapidly, incredible pace. For example, the healthcare system in Colombia was recently ranked as one of the top performing healthcare systems in the world. It is probably one of the top 3 top performing healthcare systems in Latin America. So that helps the clinical trial industry. That helps medical device companies that are looking for a place or a destination for their early feasibility research, cost effectively and ethically, and also helps companies to access the market when they already have an FDA or CE mark approved product, because as the healthcare system matures, access to the system is easier or faster, or and reimbursement is something that is easier to obtain. I don't know if you knew, but healthcare is a constitutional right, it's a human right in, a lot of countries in Latin America.
Yeah.
So that guarantees reimbursement. So, and that's kind of a fairly recent thing in the region. And that helps companies sell their products because they can have reimbursement, which is really key.
Yeah, and I think that's true as, companies look at expanding their, market and their growth. A lot of it is coming from some of those emerging markets that have historically been underserved. So Latin America is, definitely a key region that, a lot of companies are looking at as a growth opportunity.
Yeah. And going back to Europe, I see a little shift happening. We do clinical trials, clinical research. That's our area of focus. And we help U.S. companies do trials in Latin America with special focus in Colombia. And in the past 6 months, Mary, I've seen an influx of requests for, more than ever. I've never been busier to do trials in Latin America, in Colombia. Just recently, last week, I got a request from a company that was doing a trial in Australia, and they are not happy with all the factors involved with a trial in Australia: time zone, geographical location, the distance to fly there, the jet lag, the COVID, the pandemic situation, the lockdowns, the inability to travel, all that stuff, which Latin America doesn't have, and it's closer, and it's cheaper and faster, and easier to recruit patients. So I see
think
a trend.
As more as companies look at that opportunity and have that positive experience, it's just going to strengthen that, compelling business case as well to continue to expand and look at opportunities in Latin America.
Yes, absolutely. And I also see, Mary, a trend happening from the political standpoint. A lot of these countries are trying to move away from commodities and diversify their economies and bring foreign direct investment that is not somebody in the US or Europe that wants to set up a plant and employ 1,000 people. No, they want companies to, setting up a plant is great. That gives, that employs a lot of people, that brings money to the economy. But they're looking more at transfer of knowledge, which is really key. When you bring new knowledge, you raise the level, you elevate the community, and then that local economy will become more competitive in the world, and eventually will start exporting its own knowledge. And that's what.
That's right.
Yeah, that's what countries like Chile are doing, Colombia is doing, or trying to do, because commodity prices are down, and they're looking for alternatives. So
I think it's really developing those key capabilities that are beyond just basic commodities, and really, elevating the workforce and the types of jobs and roles that people are going to have that, elevates the economy as well. So yes, that all goes together.
Yeah. And the OECD, what's happening with the OECD, and not many people are talking about this, Mary, I certainly don't see it in the news at all, is that, as I alluded to, the first country was Chile about 10 years ago, then Mexico, then Colombia about 5 years ago, and now we have Peru on the ascension path. And these 4 countries are part of the Pacific Alliance. And then you have Costa Rica that just joined less than a month ago. Panama is looking to join also the OECD and the Pacific Alliance. So these best practices of attracting foreign direct investment are being implemented in at least these countries that I just mentioned. And it will create a different set of advantages or benefits for foreign companies to do business in these countries. For example, the common regulatory environment. That is really kind of the holy grail for medical technology companies to have in Latin America. As you know, right now we have over 30-something countries. Every country has its own regulations, right? Its own FDA. So it's a mess to deal with all these submissions and everything. So it'll be fantastic. Eventually, it will happen. It is starting to happen with cosmetics, starting to happen with low risk devices, and eventually it will include everything: drugs, high risk devices, and everything. Where if you submit in Mexico, the approval will be recognized in Colombia or in Peru or in Chile.
Yeah, and certainly any opportunity to reduce that complexity and streamline the process is going to be beneficial for everybody.
Absolutely. So, Mary, we're close to the end of the show. What will be your muscles of wisdom? What would you say to the CEO of a medical device company that is just looking to expand or to do business or to do manufacturing in Latin America? What will be your final words?
I think that there's such a good infrastructure of really good companies in there that you can leverage a lot of the capabilities that are there, the strong supply base, whether to start your own company there or to leverage some of the existing providers that are down there. There are the top, medical device companies and medical device suppliers that are already established there. So I think it's a good opportunity to leverage, some of the existing infrastructure and companies that are set up a presence there and have had tremendous success in that region.
Very good. Now that you mentioned that, establishing a presence in Latin America, I think is very advantageous. Right now, because of the OECD, countries are increasing their investment in science, technology, and innovation. So there are tons of grants, government grants, free money available to companies when they want to do a trial, they want to manufacture something or research something in Latin America. In the case of Colombia, for example, millions of dollars. I think my last count was like $200 or $300 million available for companies to do research. So
yeah, and I think those types of incentives and support definitely help make a compelling business case for companies.
Exactly. So now you have a very good value proposition for your clients to tell them about the benefits of Latin America. All right, Mary, thank you so much for being here in our show. I appreciate your insights, and I look forward to being in touch. And I'm sure that listeners got a lot out of your experience and knowledge of the region.
Well, thank you. It was nice talking to you today.
Bye. Take care.